It is often known as supportive care, is another word used for palliative care, and it does focus primarily on pain management, symptom management, psychological support, psychosocial support, counseling, and does include the family member, the patient family member, as well as all the other members of the family, so that it does, the aim is to increase quality of life for all of these individuals. It can be offered inside of a hospital or even in the home, so it can be available in a variety of settings, and is a comprehensive team approach, so that it may involve a number of members of the team. The total goal of increasing the quality of life and comfort for the patient and the family. Well, our major mission is to increase the quality of life for patients with chronic or life-threatening illnesses, and palliative care fits into that mission very nicely. It's also an area that there are very few programs including palliative care in many of the settings that we do research in. Palliative care is important for all people who are dealing with chronic illness or life-threatening illness, and so you're right, much of the focus is on the older population, which is one of the reasons why we are encouraging the use of palliative care with the younger population. I think that people don't always think of it, and yes, it's very important for children and for their families. And so part of our goal is to get people to recognize that. Well, palliative care focuses on improving the quality of life for those with chronic illness or life-threatening illness, and it does not necessarily mean end-of-life care. Now, hospice care can include palliative care as well as end-of-life care, but palliative care really refers to the supportive care for symptoms that patients are experiencing, and also the supportive care that would be available for the family members as well. The intention of the Pediatric Palliative Care Conversations Matter program is to increase the awareness of the availability of palliative care, to increase the understanding that it is helpful for pediatric patients and their families, also to stimulate people to start these conversations earlier, to start the conversation about palliative care earlier in the illness, and to maintain those conversations so that they will be ongoing as the course of illness may change. And ultimately for us to be able to stimulate people to increase the use of palliative care across the country, so that healthcare providers will be aware of it and will suggest it and begin using it in their practices and with their patients more widely. So the resources offered as part of the campaign include videotaped information, vignettes, explaining what is palliative care, when it's the most helpful, how you can obtain it, and also includes a vignette of a parent with a child who was diagnosed with a serious illness, and she tells her story of how palliative care was helpful to her child, and describes what it meant to her to have that available. Also, as part of this, there are printed information, informational sources that are available, including a customized tear-off pad, which includes hints and tips about palliative care, when to use it, what does it mean, and also includes spaces so that the healthcare practitioner can make notes of in the interviewing with the parents and the patient, can make notes that will be helpful to them when they're following up with the patient, but also can tear off a piece of this pad to go home with the family member to help them stay along with the plan that has been developed for themselves, for the patient, and also for the family.